Oh, welcome to another episode of The Gravity Doctors. I'm Dr. Brennan Spiegel. I'm a professor of medicine, I'm a gastroenterologist, and I'm the author of the book Pull, How Gravity Shapes Your Body, Steadies the Mind, and Guides Our Health.
And I'm Dr. Lachlan Kent. I'm a cognitive scientist interested in mental gravity, how the body and mind work together to manage gravity overall.
And together we're the Gravity Doctors. And in this podcast, we talk all about how gravity shapes our body and how our relationship to gravity helps determine our health. And today we're going to be talking about this idea of the gravitype. And how do you know what gravitype you are? And what does that mean? And so we're going to actually take a quiz today, you and I, and we're going to score ourselves because we made a quiz to help people out there figure out what is their gravitype, what does that say about their mind and body, and how can they improve their relationship with gravity.
So just to be clear, this is an evidence-informed approach at the moment. We haven't tested this empirically. This is just based on the principles that we're developing under biogravitational medicine and health. How can we translate those into sort of heuristics or ways of thinking about it in really general terms for education and for information, not for diagnosis and treatment yet. This is something that we're going to develop and maybe test in the future, but as it stands now, it's an entry-level way of thinking about it.
Yeah, that's absolutely right. And in the book Pull, I describe this idea of the gravitype. That's a term you came up with. And we'll get into the details, but the big picture is this idea of gravity resilience. And when we talk about resilience, we talk about sort of the ability to bend without breaking, you know, like a tree can move in the wind, or a bridge is holding up against the force of gravity. And, you know, it could be stressed and bend a little bit, but not break if it's been constructed correctly. And so gravity resilience is how well do you stand up to the force of gravity? And we like to break it down into 3 bits. So the first is your gravity fortitude. And this is kind of how strong are you? Yep, it's muscles and bones, but it's also pumps and tubes. So on the inside of the body, we've got a bunch of pumps and tubes that are moving fluid, blood and lymphatics, and even digestive contents against the force of gravity. And so this is all about your physical body. Can you stand up to the force of gravity and stay up without passing out? Then, once we've got that secure, we have to kind of keep ourselves balanced. And this is all about sensing of gravity. We call this gravity sensing. And this is through the nervous system. So the nerves are taking in all this data constantly about the world around you, and it's transmitting the data through different systems. The inner ear is one. There's something called proprioception, which is how well you can sort of balance in relation to the Earth's pull. And then all of those data end up in the brain, and then comes really your department, which is the mental gravity. So what's that?
Yeah, so the body is sensing gravity in a lot of different ways. We said the inner ear, proprioception, the gut, you know, there are mechanosensors in the gut as well, like you call it, the G-force accelerometer.
Yeah.
So all of that needs to be combined into a sort of whole body representation of graviception, of the graviceptive input. So to do that, that sort of goes to a high order associative part of the brain called the anterior insula. And that part of the brain is involved also in emotion, in sense of well-being, in homeostasis, and also something like mental imagery. So that's when we sort of take all that physical input and make it just a mental construct that we can use. So we're using that mental imagery to predict graviceptive input over time. So we're learning how to manage gravity. If the body is the symphony that's playing the music, is the orchestra that's playing the music, then the mind is the conductor, and the anterior insula is like that conductor. It sets kind of the emotional tone around it, and that's what mental gravity is.
Okay. So we've got 3 bits now. There's the gravity fortitude, there's the gravity sensing, and there's the mental gravity. And each of those can be scored. And that's what we're going to do today, is we're going to score ourselves. And those of you listening along, we'll give you a website. It's in the show notes, tell you where this questionnaire can be found. It's called the What's Your Gravitype Quiz. And each of those three big components we're going to score. And depending upon whether you're high or low in each of them, it's going to map to a gravitype. So for example, and we'll get to the details, your gravity fortitude, you might be vulnerable, right? Or you might be durable. Those are two extremes.
Yep.
Durable, just like it sounds, or strong, you could stand up. Vulnerable, your body is at risk of gravity intolerance.
Yeah.
Like low back pain is gravity intolerance. Then there's the gravity sensing. You could be hypersensitive to gravity, which too much of a good thing could not be good. Or we call it normosensitive. Like you sense gravity as you should, not too much. So there could be too much of it.
And so you can have combinations of those two. So
You
you
have
can be
combinations of those
durable
two.
and sensitive, or
Yes.
vulnerable and sort of less sensitive or insensitive.
Right.
Yeah.
And then comes the third dimension. So you can almost imagine a cube in your mind of three axes. But you don't have to see that. You could just think of the third as mental gravity. And here we could be lifted up or weighted down, right?
So it's the tendencies. There are different questions here that are looking at different tendencies, and the idea is to develop some kind of psychometric, biometric questionnaire over time that is, it's got norms and it's got data behind it. At the moment, this is just a pilot version that we're using just to inform and maybe to fuel that research. This might be the sort of prototype.
Right. So the ideas of this questionnaire are all in the book Pull, and we're going to go through the questionnaire now. And so you can find the questionnaire in a few different places. I have a personal website, and we'll put this in the show notes. So it's BrennanSpiegelMD.com. And on there, you can find the Gravitype Quiz. And you can also go to virtualmedicine.org/pull/. But again, we'll put that link in the show notes. So we go here and it says, discover your gravitype. And I'm just going to read what it says here. So it says, gravity is with us every moment, shaping our bodies, influencing our minds, guiding how we move through the world. Each of us responds to gravity differently. Some feel steady and resilient, while others feel weighted down and dizzy or anxious under its pull. These patterns form your personal profile of gravity resilience, known as your gravitype. Now, this is an interactive quiz, and it guides you through a series of questions to help identify your gravitype. And by the end, you're going to see which of the 8 profiles best reflects your relationship with Earth's constant force. So, as we said, this is a wellness tool and not, a formal diagnosis. You need to see a doctor if you really want to understand if you have a condition or diagnosis. So let's go through the questions then. And I'll answer them as myself. And you're going to do the same thing?
I'll do the same thing.
Okay.
Yep.
So the first few questions are all about gravity fortitude. And the first one is when you try to open a new twist-off jar, like pasta sauce, what usually happens? So, you've got like this hard jar, and sometimes it's got the suction in it. You got to really grab the tomato sauce jar and pull it open. How easy is that to open for you? So, can you open on the first try without effort? Do you need to work at it a little bit? And you need like a rubber grip, put some hot water on it. Do you need a tool? Do you need somebody else to help you? You can't even do it. Like, those are the options. So we don't have to go through every one here. For me, I can pretty much open on the first try.
Me too, yep.
Okay. Now, why are we even asking this? And this has to do with grip strength. That's really what this is about.
Yep.
And grip strength is just like it sounds. It's how much force can you exert with your fist, with your grip. And you can measure this with something called a dynamometer. And there are different standards for different people, men versus women, at different ages. And it turns out the reason this is so important is it is a predictor of longevity.
Yeah.
Especially in older age. It's a predictor of survival.
Yeah.
And it's not just about the grip strength. That's really a measure of your overall body strength. And that has to do with how well you can fight gravity.
Yeah.
So that's why we asked this question first.
Yeah, it's not just plucked out of nowhere. There's a science behind it. That's what we're saying. It's evidence informed.
Yeah, exactly. Yeah. Okay. Now, the second question is about if you were to be walking up some stairs. So imagine you have to walk up 4 flights of stairs at a normal pace. How does that feel to you? Is it easy? Can you easily walk up 4 flights of stairs? You don't need to take a rest. You're not short of breath. Or do you feel, requires some effort, but you can still keep going? Or maybe you get a little short of breath and you have to slow down, or you just avoid stairs because you're not going to make it.
Mm-hmm.
So for me, I can easily go up 4 flights of stairs.
You're a marathon runner. I'm not a marathon runner, but I can do two flights of stairs easily.
Okay. This one's 4, though. So can you go 4?
Sure, yes.
Okay, 4 as well. Okay.
Yep.
So it used to be 2.
Yeah, you've upped it.
You've upped the ante. All right. So what are we looking at here? I mean, when you go upstairs, you're fighting gravity. And you're looking at leg strength and also cardiovascular strength.
Yep.
How well can you exert your body, both the pumps and tubes on the inside, the breathing, and the musculoskeletal strength to get up a flight of stairs?
Yep. So it's not just muscular strength, it's how everything works together, the cardiovascular as well.
Integrating pumps and tubes and the muscles and bones. Now, the third question is, over the past 3 months, how often have you had back pain anywhere in your back?
Now, this is where I'm going to answer poorly because I've got a back condition. I've been to see physios. I've done yoga for 10 years to try and control it. I played cricket when I was young, and it involves a lot of unnatural bending and twisting at the same time. So I've got that sort of wear and tear, also family history of it. So for me, this is nearly every day.
Okay. So back pain is one of, if not, it may even be the most common condition of humankind.
Yeah.
And it goes back to this idea that we emerged as as 4-legged creatures, then to 2-legged creatures.
Yep.
And so it's only relatively recently in our evolutionary history that we stood up on 2.
Yeah.
And our center of gravity became very narrow, right in the middle. And we have to put all of our force on these 2 legs, and the lower back just takes the brunt.
As the hinge, like that hinge kind of wears out over time. That's what's happened to me.
That's what gravity intolerance is all about. Now, I also played sports, and I used to do ultimate frisbee. I played ultimate frisbee in college, and that's also very unusual twisting. And I hurt my back quite a bit playing that, and it took quite a while for me to recover from that. I still do get some back pain, but I would put it as occasional, mild, and manageable, which is choice B. And you guys will, anyone following along, be able to do this when you check it out yourself. Now, the fourth question, and there are 16 questions, so we're about a little ways through here, quarter of the way. If you had to stand in place for 20 minutes, so let's say you're in a long line, or you're waiting for a bus and maybe you just missed the bus and you're waiting, or you're at a subway station, how would it feel to you? And so the options are comfortable. I could keep standing without a break, or, I'm going to feel it a little bit. It's noticeable. There's some back or leg discomfort, but I can keep going. Or it's really uncomfortable and you need to shift around, you need to lean. You might even need to take a seat for a moment. Or frankly, you just really can't even do that. You avoid standing this long. Need to sit down. Now, obviously, this is for people who can stand, and not everyone can. So that's important to point out. So for me, I have a standing desk at work, and we'll talk about that because this is evidence-based. And, standing is really important to engage gravity. And, James Levine at the Mayo Clinic is famous for saying that sitting is the new smoking.
Yeah.
So we need to be able to stand and fight gravity. And so for me, I can easily stand for 20 minutes. I do it every day. I stand for hours and hours because I just have gotten used to it.
Me too. Because of my back problems, I was a very early adopter of the standing desk. I even sort of jimmied one out of a filing cabinet where I pulled out one of the drawers, and that's where I had my keyboard for my computer. So when I transitioned to office work, my back really started playing up. So to me, answering this question, it kind of depends on how my back is. If I've had a flare-up of my back, this can be uncomfortable. So I'm just going to answer this on a typical day. Typically for me, this is comfortable. I can stand for 20 minutes.
Okay, so we both say choice A, comfortable. The next question 5, is when you stand up quickly from sitting or lying down, how often do you feel lightheaded or woozy or faint? So what we're getting at here is there's something called orthostasis, which is where blood pressure doesn't change fast enough when you're going from a seated to a standing position. Because when we stand up, we have these baroreceptors, which are these little sensors right in your carotid artery and your aortic arch, which is the big, great vessels in your chest. And those sensors are constantly measuring the blood pressure.
Yeah.
And when you stand up, gravity pulls everything down. pressure drops. And if you have enough fluid in your body, then you're going to maintain that flow to your brain. If the baroreceptors are off for some reason, then you may not get the right reaction and can feel lightheaded and dizzy and pass out. So this is all about gravity intolerance.
Yeah.
It turns out when I was younger, I actually passed out a couple times.
Yeah, me too. Yeah.
And I am a little sensitive to gravity. I do get this. And a lot of people are so-called allergic to gravity. People who have Ehlers-Danlos syndrome or POTS, postural tachycardia syndrome, they get a lot of lightheadedness. So the options here are never, rarely, sometimes, frequently. And for me, I would say, I guess I'd say sometimes. And I may need to pause and steady myself. There are times when I get up and I'm like, yeah, I need to get up slowly, bring my head up slowly and not too fast.
Yeah. So this is something that has changed for me over the last few years. So I have a thyroid condition. And when my diet wasn't working with that condition, I used to get a lot of lightheaded episodes from standing up too quickly. But since I've sort of fixed my diet, I drink a lot more water. I'm more conscious of that kind of balance during the day. I don't think I've changed the way that I stand up, but I've actually got a scar on my chin from passing out after donating blood, after being depleted of a little bit of fluid. So I'm sort of conscious of it, but I don't think I'd now change how I stand up. But I think sometimes it's still there. Like I can remember having, not blacking out, but having to put my hands on the ground and stop myself from blacking out. I think maybe once or twice in the last few months. So I'm going to say sometimes.
Okay. We both said sometimes. Okay, question 6. Now, what this is asking for is height and weight. And from there, it's going to calculate the body mass index, or the BMI. So what's going on here? So, this is really about body weight, and is it proportional to your height? And just to be clear, BMI is not the perfect measure.
Rough, yeah.
It doesn't work for everyone, but it's a pretty well worked out measure that can predict a number of important clinical outcomes.
Yeah.
And if you are carrying too much weight, you literally have too much load on the body, and this holds you down. It pulls you down against gravity. And so the lighter you are, in general, the more buoyant you are in a way.
Because it can drive other conditions like back pain. So carrying too much visceral fat.
And ankle swelling, and then you get into diabetes and high blood pressure and metabolic syndrome are all tied to extra weight on the body. And irritable bowel syndrome is associated with extra adipose or fat tissue in the mesentery, which is the suspension system in the body that holds up our belly. So I always refer to it like a sack of potatoes that's being hoisted up on a hook or something. So all of that can get thrown off if we weigh too much. And so what we're going to look at here is our BMI, and the higher the BMI, the lower the gravity fortitude.
Yeah, okay.
Okay, so here's an interesting point. I used to be 6 feet tall.
Really?
Yes. Now I'm about 5'11" and a quarter.
You've compressed.
Yes.
Your vertebra,
gravity.
your discs.
Gravity.
Yeah, it's dragging you down.
People get shorter.
Yep.
And if you actually measure yourself lying flat, horizontal, and you just keep your feet up at a 90-degree angle, and then you have somebody measure you from head to toe,
you're longer.
You're upwards of an inch different.
An inch?
Than then you measure yourself standing up again.
Wow, okay.
So, astronauts get elongated because there's no, they grow out.
Really?
So I'm going to go with 5 foot, 11 inches, 11.25 to be exact. And weight has been changing a bit. By the way, I've been on a 1 meal a day diet, some intermittent fasting, trying to get some weight off because I run marathons, and it's really been I've had some injuries on my body, in part because I've been a little overweight for me.
Yeah.
And when you're going to run a marathon, having extra weight puts a lot of pressure on the body. So currently I'm about 168 pounds.
Okay, so I'm from Australia, so we're metric. I am just over...
By the way, in the questionnaire, you can switch to metric
switch
here.
it, so I'm doing centimetres and kilograms. So I'm 184. I'm just over 6 feet, and I'm about 82 kilograms. So is that about 180?
Yeah, it's something like that. I'll have to do some calculations. But
okay.
Yeah.
So we're both relatively lean.
Okay, that's right. Now, question 7 is when standing up from a standard chair, which has no armrests like the ones we're in now, for those of you that are watching, without using your hands, how does it typically feel to stand up? So I'm going to demonstrate. Okay, just did it for those who are watching. Can you stand up on the first try without using your hands? Or do you maybe need a little extra momentum to get up? Or do you need to use your hands to push off? Or can you not do that at all? So for me, I can easily stand up, thankfully.
Me too. So again, this is for people who can stand. So for those who can't, they can skip this question, or maybe there needs to be an NA in this one as well.
Yes. Yeah. Okay. Now, this is getting to the end of the gravity fortitude questions. And this is the last one. By the end of a typical day, do your ankles or lower legs look swollen? Maybe you have sock marks or puffiness or something called pitting edema. That's the technical term we use in medicine, where if you were to push your thumb into the ankle and let go, if there's a pit remaining where the finger had just been pushed, it's almost like pushing into a pillow, then it slowly fills back in again. That's called pitting edema. That means there's extra fluid because gravity has been pulling the fluid down, and the venous return and lymphatic return, the pumps and tubes in the body, are not returning that fluid back up to the heart to circulate it.
So I just did a long-haul flight from Melbourne to LA, so I wore compression socks to aid in this. If you're sitting down and you're not able to move around that much, they can get rid of or lower your chances of deep vein thrombosis.
And that's an anti-gravity therapy, is compression socks, which is why we use them in hospitalized patients too, because the risk of blood clots is so high if you sit there lying in bed. Another reason to get up and move is just to keep the blood moving. And when you compress your calf and your legs and your thighs, you're essentially milking the veins, which have one-way valves. So the blood will naturally go back up towards the heart by just contracting the leg muscles.
Yeah. So I think I have a little bit of a congenital weakness here. I have a predisposition from playing a lot of sport. This is when I found out of compartment syndrome, so shin splints.
Oh, yeah.
So fluid within the sort of spaces between my shin bones and muscles, and it was a lot of pressure.
Very painful.
Yeah, I had to have it massaged out before playing Aussie rules football, and it's agony to try and get that fluid drained. It is, it's one of the worst pains. So I'm going to say, occasionally, when I look at the sock mark, if I wear long socks, I tend to wear ankle socks because I don't like that sock mark. So I'm going to say occasionally after a long day of sitting or standing, there'll be a sock mark there.
Okay. For me, it's never. I just don't get that for now.
Yep.
Okay, now we're moving on to the second bit, which is gravity sensing. We've talked about gravity fortitude. We talked about pumps and tubes and strength. So this question is, how often do you feel dizzy, off balance, or like the room is spinning? And there's a term for that, which is vertigo. So it turns out I do have vertigo. I have a condition called BPPV, benign paroxysmal positional vertigo.
All the time, or is this an episodic
Not all the
thing?
time. It's episodic. And in fact, that's one of the P's in the BPPV is the paroxysmal. It kind of happens all of a sudden. That's sort of what the P means, technical term. But this is from little tiny crystals in the inner ear that break loose and float around. And it makes your whole body feel like you're moving when the only thing that's moving is this tiny, tiny little otolith, it's called, a calcium crystal in the middle ear. And for some people who have anxiety or panic attacks, in some cases, it's actually tied in part to an inner ear problem. I'm not saying an inner ear problem causes all panic attack or anxiety.
Definitely not.
But you can imagine how upsetting it would feel if you literally are not aligned with the force of gravity and you're seeing things spin when they're not supposed to be.
And this is where the Epley maneuver comes in. So physiotherapist, or you've trained yourself to do it, haven't you? So it's a range of motion that actually brings that little crystal out of the otolith,
Exactly,
so actually draining it out to get rid of that
endolymph,
that
and there are these semicircular canals.
Yeah.
It's very involved.
It's like a
anatomy.
maze in there. So the Epley maneuver is moving that thing through the maze.
Exactly. So, and I think we have another episode all about the inner ear. So this question is getting at the inner ear. And how often does this happen? Never, rarely, sometimes, frequently. So I would say for me, sometimes. And it could be noticeable and bothersome. Thankfully, it doesn't happen too often for me, but when it happens, it's really, it's
debilitating.
very troubling.
Yeah. So I'm a never. I don't get
Okay.
vertigo.
Next question is, when you're putting on pants or socks while standing, how do you typically manage your balance? So this is getting at this idea. Sometimes you have to have one foot on the ground and one foot lifted up. And there's something called the one-leg stand test. And this is kind of a way of estimating that.
This is like the grip test, yeah?
Yeah, it's like our grip test question. So basically, how long can you stand on one leg without falling over? And ideally, you can do that for 10 seconds or more without falling over at all. And the longer you can stand on one leg without falling over, the better your balance. And this, too, predicts longevity and survival, particularly in older individuals.
Yeah.
So I don't want listeners to get freaked out if you can't stand on one leg for too long. This is something you can strengthen and work on, but it is a measure of your gravity sensing and your balance systems, and that itself is a very powerful predictor of your outcomes clinically.
So for me, I can do this easily without holding on, but, when my back isn't feeling the best, sometimes that is because it sort of throws off my balance.
Yeah.
So I'm just going to answer this in the general. Without a back pain flare-up, I can do this easily.
Okay. Yeah, I can do pretty well at this. Put on a sock. Sometimes I do get a little thrown off balance, I guess, like I lose my balance. Yeah, occasionally. So I'm going to say I can do it. Do I prefer to be near support? Sure, I do. So I'll go with B, but not worse than that.
Yep.
And again, those of you that are listening along, we'll give you a link so you can just see all the exact responses here. Now, question 11 is, how sensitive to cold are you? Like getting into a cold pool or taking a cold shower.
And again, this doesn't seem like on the face value that it's got any relationship to gravity.
That's right.
What's temperature got to do with gravity?
Yeah. So this is getting at really how fine-tuned, how hypersensitive in a way is your nervous system. And people who get really sensitive to cold often are also very sensitive to pain and have experienced a lot of pain. And I am somebody who's very sensitive to cold.
Yeah, okay.
I've always been, I couldn't get into a cold pool. When I was a kid, I would get in slowly and steadily. I'm a little cold intolerant. I am quite sensitive to cold. And I think I am hypersensitive to pain, but that's interesting because I run marathons.
Yeah.
But there I have more control over the pain, and controllability is a very important part of the pain perception itself.
Yep.
And when I run a marathon, I know I'm doing it to me, and it's going to be slow and steady, this pain, and I can handle it.
And it gives you endorphins, yeah? Like the pain itself is pleasurable.
Yeah, right.
So for me, as a child, I think I would have said that I was quite sensitive. But as an adult in the last sort of 5 or 10 years, I have practiced some cold exposure therapy. So I've bathed in like a cold ocean, and I take a cold shower every day. And I do that. I think it's part of my thyroid condition that I need to sort of kickstart my metabolism sort of artificially, and it makes me feel more alert, more awake.
Yeah.
I love water on my face, the cold water behind my ears in particular for some reason, whether that's to do with the vagus nerve. I don't know.
Yeah.
I just love that feeling in the morning, and that's what makes me feel alert.
Yeah, interesting. Well, I'm going to say at least noticeable discomfort. And I am starting to try and take colder showers just to train myself to not be
exposure therapy,
such a wussy with this cold stuff. So I'm going to go C.
Yeah.
All right. Next question is, how much do you agree with this statement? I am the sensitive type physically. I'm very aware and responsive to my bodily senses and movements. This is getting at interoception. What is that?
So interoception is, again, it's related to this part of the brain called the anterior insula. So we have exteroception, which when we think of our physical senses, we mostly think of from the environment. So vision, sound, touch, tactile, different forms of touch as well. There's pressure, there's sort of rhythm and texture. But for interoception, they're senses that arise from within the body. So it's being able to sense individual sensations from, say, the viscera, blood pressure, the heart, sweat, body temperature. So all the forces and sensations that arise from within the body. And what the anterior insula does is create a holistic impression of that. So it's like emotional tone? What's the picture of the body? What's the interoceptive state of the body overall? So you can get overloaded by exteroception, too much loud noise, too much cold water, too much bright lights. Epilepsy can be a vulnerability to exteroception. But some people are more attuned to internal body perceptions than others. So that's what this question is getting at. How well do you know your body sensorially?
So as a GI doctor, I see a lot of people with gut feelings and these butterflies.
Yeah.
We've talked about this in another episode.
Yeah.
But the idea is your gut is constantly moving, digesting. And could you imagine if you felt it all day?
All day.
Right? Most people have a filter that blocks those signals. But some people, the filter is a little more porous and they can feel those sensations. And we talk about how gut feelings can occur from, contractions and maybe inflammation, but it also can be a sense of highly attuned threat detection.
Yeah,
like you're
hypervigilance.
You're very vigilant.
Yeah.
And when you get gut feelings, it's telling you there's a threat somewhere. And we also get those feelings when we're falling on a roller coaster, a gravity challenge. We're falling down and your gut lights up and it's telling you, oh my God, you're about to die, right? And then we're like, woo, no, I didn't die. I didn't die. Right? That's your gut saying you're about to die.
Yeah.
And some people do not want to ride a roller coaster because they're very sensitive. They're very interoceptive.
Yeah.
And they don't need a roller coaster to remind them that they sometimes get that feeling even without falling.
So that's what's happening in this quiz. We're sort of building up from physical towards mental gravity. So it's like a continuum from the body to the brain to the mind. And we're sort of in that liminal zone here, aren't we? It's like what those subtle cues that the body's giving that actually have an emotional tone to them. So we're almost at that bridge between body and mind.
Exactly. So there's a rhyme and reason to this question here. It's not totally arbitrary. So I am pretty sensitive. For example, one thing you could actually do is determine, can you measure your heartbeat? Can you count your heartbeat without actually feeling your pulse? That's a test for interoceptive sensitivity. So I've tested this. I can pretty easily monitor my heart rate accurately.
Yep.
Maybe you hear it in your ears. Maybe you feel it in your chest. Some people struggle with that. It's not like there's a good or a bad. It's just different variations. So I would say I very much, consider myself sensitive to my bodily feelings on the inside. Yeah.
So I'm going to say C. I'm going to say moderately as well.
Okay. I said D.
Okay.
I went with D.
Yep.
Next, over the past 2 weeks, how often have you felt weighted down by stress, worry, or low mood, like life itself feels heavy? So now we're getting into mental gravity.
Yeah, so in that period over the last 2 weeks is how we generally screen for things like anxiety, depression, distress. It is over that sort of narrow window. So we're talking about gravitype here, so you can think about over the past 2 weeks, but also generalize a little bit as well, because it's like, well, what's my like the last 2 weeks you might have just had, a festive event and you're feeling really buoyant. So you can also sort of bring in, well, compared to others, I'm generally like this as well, but we're really tapping into what's your type of response to stress, worry, or low mood? Is it something that you can handle and hold yourself and your life and challenges lightly? Or do you sort of tense up and feel them as a weight? Is it something that really gets you down? Like, are you reactive in that way?
Yeah, right. So for me, over the past 2 weeks, I've been pretty lifted. And I'm excited that I have a book coming out, and that's been mentally elevating.
Yeah.
But at the same time, there has been a lot of stress, a lot of work, and, that can get you down physically, mentally. So I'm going to say for me, it's been thankfully occasional or mild that I've been feeling weighted down by too much stress lately.
Yeah, same for me. I'm here overseas recording a podcast, working towards the launch of your book. But the stress of doing all that, I had a bad night's sleep last night because I was replaying things in my mind and anticipating and worrying a little bit about what am I going to say, how's today going to go. So yeah, that little bit of stress, that little bit of angst, I wouldn't say anxiety, but a little bit of angst about what's to come. Yeah, it's been occasional.
Okay.
Yeah.
All right, we're almost done. There's a few more questions. The next, and these are all about mental gravity now. How do you usually respond to roller coasters? We talked about that already. Airplane turbulence, or the sudden jolt of a descending elevator. So we've all had that experience. We talked about roller coasters already, but even if you don't ride roller coasters, there's all of a sudden a little extra turbulence on the plane. You feel like the bottom comes out, your stomach kind of gets a little queasy, or an elevator's just moving a little faster than you want it to. Does that make you, how do you handle that? Are you calm and comfortable in those moments, or does it make you feel anxious? Are you paying attention to it?
Well, I can remember the first time as an adult that I was on a plane. I had a long gap between, my first flight as a child and then, I was sort of 30, I think, by the time I went back on a plane for, whatever reason. And I remember the first time the plane took off and the G-forces and then the feeling of turbulence.
Yeah.
And it freaked me out.
Yeah.
I was like, we are in a little tin can up here.
Absolutely.
Like, this feels vulnerable.
Yeah.
And it made me uneasy. I didn't get, anxious or panic. I'm like, oh, that doesn't feel right. But now that I've flown quite a few times since then, I kind of like it. I really like roller coasters when I know that it's a safe environment. So for me, I'm calm and
That just
comfortable.
shows how gravitypes can change.
Yeah.
That's what we don't know our result yet, so stay tuned.
You can build
but
gravity
I can tell
resilience.
that you have, changed, your cold sensitivity. Now you've trained yourself to not be sensitive to cold, and you've trained your mind to be comfortable in an airplane and not be as worried about falling out of the sky, right? Our goal in life is to stand up and stay up, and not to fall down and collapse into the ground,
Well, I think there's a lot of talk about resilience in mental health, and it's very abstract sometimes. It's like, can you just manage your emotions? I think we're grounding resilience here in both the body and the physical basis of emotion. Like, can you maintain physical and mental balance, because they're related? There's a continuum from physical to mental that we're going through here.
Yeah.
So this, to me, I've done yoga for 10 years as well, and I think that's improved my emotional resilience as well as helping my back and my core strength and everything. So I think we're really getting at the nitty-gritty here of gravity resilience, and where you can train both body and mind and use mind over matter sometimes.
Yeah.
Yeah.
All right. Well, for me, I would say these experiences, I do take note of them, I'm very sensitive to roller coasters. I don't love that. It's a tough one. I'm going to say somewhat anxious. Sensations can be bothersome, but this is a little tough one. We may need to rewrite this one, because there's a big difference between a roller coaster to me and a descending elevator.
Yeah.
So I'm going to go with B, actually. I'm going to go slightly uneasy.
Okay. I'm calm and comfortable.
Yeah. Okay.
All right. Two more questions
Two more
to go.
now. The next one is, when you face setbacks or failures or unexpected drops, how quickly do you regain your emotional balance and resume your usual activities?
So this is classic resilience here.
Yeah.
How do you bounce back?
So, bounce back easily, move forward, or need a little bit of time to get back on track, or, setbacks can linger, maybe affect your mood or behavior, or really you can get stuck in a rut. This idea of being stuck in a rut is a gravitational metaphor too.
Yep.
And you sort of avoid activities for a while.
And again, we're talking about averages here, or what's your typical response. So I can remember during COVID, I had just finished my PhD and I had some, employment. What am I going to do? And a sort of job opportunity didn't work out. And I actually couldn't bounce back from that. There was I just had a baby as well. We just had a baby. So all these pressures and everything really got to me.
Yeah.
And for a week, I was on the couch.
Yeah.
So it takes 2 weeks to be diagnosed with major depression. That's a depressive episode. But I was depressed and physically unable to get up for a week. I was just wiped out.
Yeah.
But that's atypical for me.
Yep.
I think more generally, sometimes I need a bit of time to get back on track. I would say moderately. I'm not happy-go-lucky. I'm a deep thinker. I take things personally sometimes. So I'm going to say moderately.
Yeah, I would say I'm very similar. I have experienced major depressive episodes, not often. Actually, I can only think of a couple times in my life. And in both cases, it was tied to some stressor, some significant stressor that I could not shake out of my mind. And that's a horrible, horrible feeling. I mean, I literally felt like I could not get up out of bed.
Way down.
Like gravity was literally acting on me. I was on a bigger planet. I just couldn't get out of bed. I was exhausted and you didn't have the energy. But that is not normal for me. That is abnormal for me. So generally speaking, I would say moderate. Yeah, there are times though when there's been a particular stressor, and I do feel weighted down for a little bit.
Yeah.
But you just work your way through it and get over it.
Yeah.
Yeah.
Okay.
Okay, this gets us to the final question. Then we're going to calculate, and the computer will do it for us. We're going to see our gravitype. How often do you feel, this is kind of the opposite, light and uplifted or deeply absorbed in an activity, which some people, call flow, as if you're carried upward by joy and awe and inspiration?
Okay, this is the two aspects of mental gravity that come out in the science, actually. It's sometimes a bit murky. Is there just one dimension of mental health? Is at one end you've got good mental health and the other end you've got poor? Or are there multiple things happening? You can break it down in different ways, but I think it's really helpful to think about a dual continua, that there are two dimensions of mental health and well-being. One is associated with resilience and bouncing back from negative feelings or negative events. And that is quite distinct in a lot of cases empirically. So the science is clear that is distinct from your ability or your tendency to experience positive emotions and sense of well-being and mental health. So someone even with a diagnosis of depression or bipolar or schizophrenia might have, significant periods of distress that they can't bounce back from. But within that time period, they might also feel, inspired and like they're doing, they're flourishing at the same time. Those two things can coexist. So this is the positive side. This is mental well-being.
So how often do you feel in flow?
Do you know, this is a very hard one for me to answer because I think, I spend a lot of time writing, thinking, deeply absorbed in, the world of mental gravity and sort of analysis and sort of mental imagery. So I would say it's quite often, but does it make me feel uplifted or am I just sort of...
You're overthinking it. This is an academic thinking about this question.
Yeah, that's a hard one. I'm going to say occasionally, a few times a month.
I'm going to go with very often, which is weekly or more. I very frequently do feel light and uplifted. Yeah. Very, very frequently. I mean, probably every day, unless I'm in some horrible rut or, one of those situations has overwhelmed me. Yeah. And I can move up and down fairly quickly over like a lot of people can. I don't know that it's, abnormally, variable, but there are very common times that I feel a very strong sense of uplift. Yeah. And it may not last that long. It may just be I had a really good experience, or I may have even just seen a patient. Yeah. And I had such a good interaction, and I was so gratified by their response to our conversation or whatever. And I just feel like I'm walking on air for even just a few minutes. Yeah, okay. I'm actually going to change my answer because I play music. I play guitar and sing. And that's where I feel that deep absorption and the joy. Okay. All right, good. Well, that's great. Yeah. Well, that comes to the end. We've now come to the end of our questionnaire. And now there's a little red button here that says reveal my gravitype. So I'm going to click mine. And here we go. Okay. Did you click yours? I did. All right. Should I reveal mine first? You go. I am the alert stabilizer. Okay. So I'm the gravity master. Oh. Maybe I should go back and change it to occasionally. It might bring me down. I feel like it's a competition. No, so the gravity master. Nice. I'm the alert stabilizer. So let's talk about the gravity master first, because there are 8 gravitypes. And we won't go through every one of them today, but the gravity master means that you did well in all 3 domains. Well meaning you are resilient to gravity in terms of your fortitude, your sensing, durable, and your mental gravity. So I'm happy with that. So it's got gravity fortitude is durable, sensing is normosensitive, and mental gravity is lifted. I think if I'd done this quiz 15 years ago, you would have been the alert stabilizer. A very different result, maybe even more vulnerable, I think. Yeah. Yep. Well, I think from hearing your story, this is where we diverge right now, and it's the gravity sensing. So I'm like you. I have durable gravity fortitude, and that means I have the muscle tone and the circulation and the stamina to meet gravity's day-to-day demands with confidence. You know, I'm a runner and I exercise, and you know, I'm not an Olympian or anything. You don't need to be an Olympian. You just stand up to gravity and you're comfortable.
Yep.
So thankfully, at this point in my life, I don't have any significant disabilities or chronic pain or conditions that can bring me down at this point in my life. Mental gravity, I'm lifted. So although I have had significant episodes that are short-lived, I tend to recover emotionally and find lightness even when life pulls me down. And so it's where we diverge is the gravity sensing. And I am considered hypersensitive. That means I pick up on motion and temperature and balance cues quickly, which can feel overwhelming without grounding routines. And this means I need to be aware of that, whereas you have kind of trained your body to be less sensitive. You mentioned how you did cold exposures, and I'm starting to try and do this sort of thing to be a little less sensitive.
But I think like understanding my physical health, understanding my thyroid condition, working on my diet, not getting dizzy as much, doing yoga and balancing my body out, but also exposing myself to things like, you know, plane rides, if that's part of the quiz, then I think over the last 10 or 15 years, I've become a little less sensitive to gravitational interactions.
So in this report, when you guys do this, it's going to give you a detailed breakdown of what your gravitype is. Now, the other opposite for the gravity master is the overwhelmed defender. And so that's another one. That's where you're low on all three. And you really need to work your way up from there, literally upward. I mentioned that I'm the alert stabilizer, and then there's the bracing sentinel and the cautious calibrator, and each one has its own unique story. And your report will tell you what your gravitype is, what it means, what you might notice, things to watch out for, strengths that you have to hold on to, and maybe some helpful next steps. And so, for example, for me, because I'm a little hypersensitive, it suggests that I downregulate before or after sensory triggers. Maybe try slow nasal breathing, which can activate the vagus nerve, activate the rest and digest parasympathetic state. Longer exhale, something called box breathing, where you breathe in for 4 seconds, hold for 4, out for 4 seconds, hold for 4. So box breathing. And that's a recommendation, reducing sensory load and so on. And so there's a whole bunch of recommendations. Again, this is not medical advice. See a doctor if you have persistent symptoms. This is for wellness and education, but hopefully this questionnaire can help you get a better sense of your personal relationship to gravity and some suggestions. And then in the book, Pull, I have a whole resource guide of a bunch of different exercises, and we'll be talking about all of those in this podcast.
Yeah. So for me, even as the gravity master, there are, what I might notice, strengths, helpful next steps, and watch outs. But within the quiz itself, it's sort of reinforced that, my lower back is something that I need to maintain, attention, make sure I'm getting, clinical, proper medical and health support, and it's something that I'm working on every day. I'm doing my back exercises, so this is a motivator. This is to say, this is something that I want to maintain. I want to maintain my status as a gravity master, and to do that, I need to work on everything, but especially the weak points.
Yeah. Well, I think that does it for this one. Check out the Gravitype Quiz, and you can find that in a few different places on my own website, BrennanSpiegelMD.com. And I think we should probably post this on the Gravity Doctors website.
For sure. Yeah, we will.
So go to thegravitydoctors.com. There you can find all the different places where the podcast is posted. And like and subscribe. Check us out. Find us wherever podcasts are played.
Yep.
And we'll see you next time on the Gravity Doctors.
Thanks, everyone. Cheers.
Yeah. If you like that episode, please like and subscribe and tell your friends about the Gravity Doctors. You can also follow us on social media. Check out the book Pull, and you can also check out our show notes for tips and links to some of our scientific articles. You can follow us online at thegravitydoctors.com. You can follow me, BrennanSpiegelMD.com, and Dr. Lachlan at LachlanKent.au.